Hello and welcome, everybody. Thank you very much for tuning in. I am Lucas Tietzen, and this is Blues News Media. And Happy New Year's! But with the new year, evidently, comes new fears as we open up this episode with talking about the new virus variant that is going to be sweeping the nation. You're going to be hearing all about it going into 2020 because, as we've been talking about on this show, as many people have been discussing, that the COVID-19 crisis is not going away. This is your new normal, as they say, if we let certain elements of the world have their way. But we're going to talk about that. We're going to talk about the rollout of the vaccine and a few other stories that I think will be incredibly important going into 2021. Who knows what it has in store for us? But let's begin. We have this story here, again, from the Chicago Sun-Times, talking about the new virus variant. This article is entitled, UK warns of more lockdown measures as new coronavirus variant spurs outbreak. And I just find this very convenient right when the COVID-19 vaccine is hitting the streets, which we will get into more later on. But how convenient, as they're saying that, the virus it's not going away, it's sticking around. If it changes, that means we're going to have a new vaccine. Maybe the COVID vaccine is going to just be a new part of life. Maybe it is the new flu, and it's just going to be, very basic. Naturally, we still have to regiment society, make sure everybody wears masks, social distance, because, somebody somewhere might die, and it is tragic. But that is definitely what we are being primed for right now. And it's not just the UK. If anybody's been paying attention, we see now that it is actually making its way into the United States. And I find this just particularly important because I myself reside in the United States. And I think it's first showed up in, I believe it was like Oregon or something like that. But it is now making its way across the U.S. with this article entitled, California has nation's second confirmed case of virus variant. But now, why is this important? All we really know is that, it mutated, which they have been talking about ever since this whole pandemic started. I feel like every other week I heard, it's mutating, it's becoming deadlier, it's becoming more transmissible. Naturally, there was no real evidence, no real proof of that. Hell, we haven't even been able to isolate this COVID-19 virus, but yet we're still able to test for it and all that jazz. That's a story for a different time. But so what are we saying about this new virus variant? Well, for that, we can look to this article from the Daily Mail. And this article is entitled, Show Us the Evidence. Scientists call for clarity on claim that new COVID-19 variant strain is 70% more contagious. And that's good. At least, right, somebody has kept their brain. Somebody has their mind right. But that's just exactly it. There are people that are talking about how this new virus variant is 70% more contagious. Oh my gosh. Not that they are really mentioning whether it's more deadly or that you show more symptoms. Nothing like that. It's just you have a bigger chance of catching it, which of course is incredibly important right now because it's not really a pandemic. We're more talking about case-demic, if you've heard that term before, because we're not worried about deaths anymore. Because believe it or not, guys, not that many people are dying, and the numbers of the deaths centered around COVID-19 are incredibly skewed. But we're talking about cases. So naturally, if it's 70% more contagious, that is of great import with this. Now, I just wanted to briefly touch on it. In my opinion, this new virus variant is nothing more than, giving you the next ramp up of fear. And it's going to be very convenient with this new virus variant as the Biden administration comes into power. And Biden has obviously showed that he is much more ready to play ball with pharmaceutical giants and just kind of implementing these terrible restrictions that, love or hate him, at least Trump has kind of pushed back on. In my opinion, he's a big wuss and hasn't really done much of anything. But at least he says some things, and he hasn't implemented a national mask mandate. But we know that Biden, he says from day one, we're gonna have mask mandates, and I can guarantee you he is going to ramp up not only the fear but the draconian measures that are down the pike, without a doubt. But to anybody that thinks this is true, the 70% more contagious, they take it as gospel, which naturally you shouldn't. Please always question everything. I would like to direct you to this one article written by the amazing Whitney Webb. If you don't know her work, get to know her. She has a website called Unlimited Hangout that you should go check out. But she also writes for The Last American Vagabond, another amazing site with amazing sources and writers. So please check them out. But this article is titled, "Another Flawed Data Model from Imperial College to Blame for Latest UK Lockdown." And I'm not going to, go into all of it and read it, but she does a truly terrific job of going into the Imperial College model, which was responsible for basically sending us into lockdown the first time. They sent out a model, and it was just basically saying that millions of people are going to die, blah, blah, blah. And then the government's pointed to that saying, oh, see, we need to lock down and implement all these terrible measures, because if we don't, it's going to be a mass chaos. And then it turned out to be not much of anything, and the lockdowns actually ended up doing a lot more harm than good. And it's all just been a complete clusterfuck, essentially. But she goes in depth about how this 70% number is complete bupkis, no evidence for it. So please read this. It'll obviously, everything that I reference here will be included in the show notes for your reading pleasure that I greatly implore you to go read. But if you need to shatter this story, this reality, I highly, highly recommend it. But moving on, as we see this new virus variant being, screamed from the media pulpit, we also see the vaccines rolling out. But not everybody is so crazy about the vaccine. I know I'm one of them. Almost everybody I talk to says, well, I'm not going to get it yet. I don't know if there's any side effects. It seems really rushed. It seems like more and more people, as time goes on, are finally questioning this vaccine and are saying either outright, no, I'm not going to get it, or they're saying, I'm going to wait until there's more evidence that it's actually safe before I take it or my kids take it, which is great. That's good. That's what we want. So just remember that. I know that was the topic of the last episode, that you are not alone in your skepticism, of your criticism, of your suspicions of this new vaccine. And it is important that we all talk about it out loud with people, our friends, our family, hell, with strangers, just so we can all kind of, get on the same page. There's definitely this whole, you question vaccines, then you're an anti-vaxxer, and then, you're immediately discredited for some reason, which is just entirely untrue. But continuing, even from this one, from the New York Post, this vaccine is entitled, "Majority of Ohio Nursing Home Workers Not Taking COVID-19 Vaccine." And this article opens with, about 60% of Ohio nursing home workers have so far opted against taking the COVID-19 vaccine, as deaths linked to coronavirus have soared in the state, allegedly, if you believe those numbers. "We aren't going to make them, but we wish they had a higher compliance," Ohio Governor Mike DeWine said of the nursing home staff at a Wednesday press briefing, the Columbus Dispatch reported. Everyone makes their own choice, but we want to make it clear that opportunity may not come back for a while, the governor said. The high number of nursing home workers electing not to take the vaccine comes as the state experienced its deadliest month of the pandemic. Ohio reported 2,426 deaths from COVID-19 in December, the report said. Overall, since the onset of the pandemic, over 8,800 people in the state have died from the illness. Now, that's great. Naturally, these nursing home workers, healthcare workers, they were always going to be the first ones that had this big push to get this incredibly experimental vaccine. And I just find it very interesting when we were reporting on there's many people that are not going to want to take the vaccine. It was always maybe, I remember on the onset, it was like 50 or so. Then I think they were skewing the numbers. Then it became like 40, 30, and it kind of hovered around there. Now that the vaccine's out, they can't even hide it. 60% of Ohio nursing home workers don't want it. 60%. That is a great deal of people. And then who's to say how many were the other 40% saying that they will take it? Was there a split and like maybe some are just unsure? So there's, I like how they kind of skewed that in this reporting, but it's something that definitely needs to be questioned. But they're not alone. We can also go to here. This is another article from the Daily Mail, and this article is entitled, "Up to 60% of U.S. health workers are refusing to get COVID-19 vaccines over fear of side effects." Now, if you remember, the other one was Ohio nursing homes. And then just to read a bit of this article here, it opens with, "Thousands of healthcare and frontline workers across the U.S. are refusing to get COVID-19 vaccines as the rollout of the shots in America continues to sputter. Up to half of healthcare workers on California county and a Texas hospital say they will not get the shot. 60% of nursing home staff in Ohio are turning down the jab, and 40% of frontline workers in Los Angeles won't get it either, polls reveal." And now, isn't that just incredibly convenient? And they have a really, really good excuse for it. They are worried about, we don't want that pop up, the side effects. And I'm worried about the side effects. Everybody should be worried about the side effects. I mean, you only got one body. Why would you go and get an experimental vaccine when there's been nothing but story after story of people getting hurt or having weird side effects from it? Not that all of them are going to get these weird side effects, but it seems like a big portion of them are, which is incredibly concerning. But again, like I just stated, months ago, before the vaccine came out, they were downplaying it. Oh, only about 30 or so people are not going to get it, blah, blah, blah. Now the vaccine's here, and they can't hide it. 60%, 40%, half of people in healthcare workers in California. Nobody trusts this thing, and why would they? They rushed this vaccine out in, 10 months or so? Skewing the data, saying that, oh yeah, it's 95% effective, which we will get into that also. But it's creepy, it's scary, and I'm not going to tell you how to live your life. Get the vaccine if you want. All I know is I'm not going to get it. Everything I've been seeing is a giant red flag that says this thing is dangerous. And I've talked to my family about it. I've talked to my friends about it. I don't want anybody to get this if they don't have to, because it seems incredibly dangerous. But all these people are worried about the vaccine side effects. And there's a really good reason for that. I'm sure they'll say in one breath, oh, yeah, everybody's worried about the side effects, but you should get it anyway. Like, you shouldn't be worried. While at the same time, if we look at this article here from New York Daily News, this article is entitled, "More Allergic Reactions Triggered by COVID Vaccine Than Scientists Expected." It's more than they thought. But yet we're still supposed to march when we get our orders to go roll up our sleeves and get this experimental vaccine, even though there are many people having allergic reactions. And even if you have an allergic reaction, you can't sue the pharmaceutical company that made it. So, I mean, why would they make it safe if there is no real legal or financial repercussions? Am I right? But maybe that's just me and my conspiracy mindset. But just looking at this article here quick, it opens with, the head scientific advisor for Operation Warp Speed revealed there have been significantly more allergic reactions to the COVID-19 vaccine than other immunizations. Dr. Mansef Salawi told CNN that as of Tuesday, that 6 people have experienced reactions to the 2-jab treatment developed by pharmaceutical company Pfizer and its German-based partner BioNTech. I don't know, that's how I pronounce it. I don't know if that's right. He added that the data on coronavirus inoculations has been slow, meaning there could be more cases experts are not yet aware of. Who would have thought? That frequency, as it stood yesterday, is superior to what one would expect with other vaccines, he said late Wednesday. So, I mean, there you have it. I mean, even the leader of Operation Warp Speed, these scientists, these experts, they're shocked. Who would have thought a rush vaccine with an experimental method that we've never really proven has worked before is now having adverse side effects for a lot of the people that we are giving it to, while we're still saying, oh man, you're fine, it's totally safe. How bizarre. But this isn't, centered alone around the United States. We can look to this article from Reuters. And this article is entitled, Mexican Doctor Hospitalized After Receiving COVID-19 Vaccine. This is incredibly scary once you see the side effect that this doctor came down with. So we'll just read a bit of this here. The article opens with, Mexican authorities said they are studying the case of a 32-year-old female doctor who was hospitalized after receiving the Pfizer-BioNTech COVID-19 vaccine. The doctor, whose name has not been released, was admitted to the intensive care unit of a public hospital in the northern state of Nuevo Leon after she experienced seizures, difficulty breathing, and a skin rash. So that seems like pretty severe reactions. The initial diagnosis is, I'm going to butcher this, encephalomyelitis, the health ministry said in a statement released on Friday night. That the encephalomyelitis is an inflammation of the brain and spinal cord. Seems pretty severe, pretty messed up, if you ask me. The ministry added that the doctor has a history of allergic reactions and said that there is no evidence from clinical trials that anyone has developed an inflammation of the brain after the vaccine's application. And yet, I mean, that might be true. She has long history of allergic reactions. But then, why wasn't that discussed before we just, whipped out this vaccine, started just giving it to anybody and everybody that was in the healthcare industry? Why wasn't there discussions? Why weren't there, questions about their medical history if they knew this thing was experimental? It was rushed. And had all these side effects during the actual safety trials. They really don't care about your health at all. All they really want is the money. And you can argue with me about that till the cows come home, but I will always say, think back to 2019. Everybody was on the same page when they were saying pharmaceutical companies don't give a damn about you. They like it when you're sick because they make more money. Why would that change during the pandemic? It's not like their altruistic values were going to come out of nowhere and say, oh yeah, now we're going to save humanity. No. If anything, they saw the pandemic, they got all hot and flustered and had money signs in their eyes because they knew they were going to get a giant payout. And that's just how I see it, at least. And naturally, as this continues, the Pfizer and BioNTech could not immediately be reached for comment. Now, even though you have all these side effects going on right now, and you have many, many people saying that they don't want to take the vaccine or anything like that, they're still encouraging you to do it. Hell, they may force you to do it. as we look at this article here from Business Insider. And it's one of our Lord and Saviors, Anthony Fauci, who we all love and praise and have to bow down to, evidently. And this article is entitled, Fauci says he's sure coronavirus vaccinations will be mandatory in institutions like hospitals and schools. Never mind your pesky ideas of bodily autonomy. You don't own your body. You don't get to decide what you can and cannot do with it, you silly little goose. We, the scientific lords, will say what is good for you, what is bad for you, what to put in your body, and things like that. If you want to work here, go to school there, and as we'll go over later, travel here or there, you're going to have to get the jab. You're going to have to be inoculated or whatever with an experimental vaccine. Naturally, it's for your own good. Never mind all those pesky stories of, brain and spinal cord inflammation or Bell's palsy where your face is sadly drooped. Don't worry about all that. It's for the public good. Get the vaccine. Continuing, this article opens up with Dr. Anthony Fauci, the nation's leading infectious disease expert, said he expects the coronavirus vaccination to be mandatory in some institutions in the future, probably the near future. In an interview with Newsweek published Friday, Fauci said he's sure institutions like hospitals will mandate the vaccine. I'm not sure the vaccine is going to be mandatory from a central government standpoint like the federal government mandates, he said, but there are going to be individual institutions that I'm sure are going to mandate it. And I've thought this for the longest time. I don't think that the government's going to, pass a law that says you have to get it. That would be too controversial. It would get too much pushback. Most probably, it's going to be your employers are going to say, you need to get this vaccine if you want to work here. It's a, what do you call it? And it's a health insurance thing. If you don't, we just can't employ you. Naturally, your kids can't go to school if they don't get the vaccine because they might go ahead and spread it to other people. So they are going to do everything that they can. Whoa, the page crashed on me here. But they're going to do everything that they can to make sure that you get the vaccine. It's not that Big Daddy government is saying it. It's that, institutions of society are saying it. For some reason, that's more acceptable. And I just think it's funny that as this is happening, we are finding out that this whole vaccine here, this is another Business Insider article, it may not even prevent transmission, And we can see that here from this article that says top World Health Organization scientist says vaccinated travelers should still, quarantine, citing lack of evidence that COVID-19 vaccines prevent transmission. And the article opens with, the World Health Organization is urging even people who have received a coronavirus vaccine to quarantine when they travel because there is not yet evidence that vaccines prevent people from transmitting the virus. World Health Organization's chief scientist Swaminathan noted on Monday that the agency had not established whether the COVID-19 vaccines being administered across the U.S. and in Europe prevent people from getting the virus and passing it to others. Which is just really, then what the hell is the point of getting the vaccine? It doesn't prevent transmission. There are other options for lessening symptoms. So really, what the hell are we doing here? What are we really doing here if it's not going to prevent transmission? And as we reported last episode that Anthony Fauci says that we're still going to have social distancing. We're still going to have mask mandates. This is the new future. We've all signed on for it in one way or another with our complicity. And it is truly, truly scary. If this happens, if they are allowed to say that no matter what, even if you get the vaccine, you'll still have to quarantine. Even if you get the vaccine, you're still going to have to wear a mask and social distance. This is truly not only the completely restructuring of society, it is the destruction of the idea of that it is your body, your choice. You are born into this body. You get to do with it whatever you please. Obviously, they're now saying that's just not the case. You don't own your body. You don't own your existence. You are beholden to other people, which is truly, truly scary. Because if this happens, who knows what we'll accept later down the line. But I also find this interesting. I have something in my mouth. That as they're saying that even if you get the vaccine, you should still quarantine because it won't prevent transmissions. It's just such a joke. You're also going to probably need a little vaccine passport. Oh, I remember when everything was first hitting the fan and I was a conspiracy theorist. Many people were conspiracy theorists because we were saying that you're going to have evidence of your vaccination. You are not going to be able to travel if you don't get a vaccine. And we were laughed at. No, that'll never happen. But as they floated the idea more and more, which is very common, they soften it up in your mind so that you'll accept it when it actually comes into being. Now everybody's just like, well, of course you need it. Sure, you were a conspiracy theorist before, but of course you need the COVID vaccine if you want to travel. I mean, how else are we supposed to beat the pandemic? Am I right? People do not realize you are being made to love Big Brother. Just like in George Orwell's 1984, he loved Big Brother in the end. You will be made to love your servitude. But, I was the crazy one. I was the kooky conspiracy theorist. This is just all completely, totally normal. I mean, everybody's doing it. Even way back in April. Remember that? April of 2020, when everything was hitting the fan, everybody was losing their minds. We had China was the first one to roll this out. They were fighting the coronavirus with a digital QR code. And here's how it works. And now basically what they'll do is you'll have to get the vaccine and you'll get the nice green good to go QR code and you'll be all set. Maybe you'll be with this contact tracing, if you're within the area of somebody that had COVID, maybe it'll be yellow because he was in an area for 5 minutes with somebody else that ended up testing positive a couple days later, obviously showing no symptoms. Or you'll have red because you tested positive, or you live with somebody that tested positive, or work with somebody that tested positive, and now you won't be able to travel and this, that, and the other thing, and they'll just restrict you being able to operate society. I mean, we're playing for all the marbles here, guys. This is truly total control of the human species. Not just movement-wise, but also like surveillance and control of the body. There is no place to hide, and there is also no time to sit back and just take it if you truly do not want to live this way. The battle's going on now, and they are pulling out all the stops. And I can show you that with this last one article here that we are going to cover. Hold on here. This is from, and this is truly scary, this is from the New York Senate, the New York State Senate, sorry. Now this is a bill that is currently being worked on right now. And this bill is Assembly Bill A416. And it says here, it relates to the removal of cases, contacts, and carriers of communicable diseases who are potentially dangerous to the public health. Now, I don't know about you, that sounds incredibly broad and just leads to a world, a dystopia of pain. But we'll look at the actual bill here. So this is what's in there right now, what they are working on passing right now, and I can only see our other Lord and Savior Andrew Cuomo, just salivating on top of this paper and quickly signing it in to law. But it says here that an act to amend the public health law in relation to the removal of cases, contacts, and carriers of communicable diseases who are potentially dangerous to the public health. And the removal and detention of cases. Removal and detention of cases. Removal and detention of cases, contacts, and carriers who are or may be a danger to the public health. And this is just incredible. I mean, what is it? Cases, if you test positive, contacts, so people you come into contact with, or if you're, you might be a carrier, but maybe don't show any disease or symptoms like COVID-19. You can have it, but you're asymptomatic. So you might just be a carrier, maybe not like a full-on case, right? You can be removed from your home, detained because you have a disease. And this, keep in mind, it's not saying COVID. This isn't specifically for COVID. It is for communicable diseases. That means like anything that you can catch or spread, they can just take you away. They can take you out of your home and detain you. And I do not want to hear anybody saying, oh, that's crazy conspiracy theory. That's just wacky. Oh, that'll never happen. What the hell is it doing in the New York State government then? Why is it about to probably pass? I mean, I'd be shocked if it didn't. What are we doing here? How are we just letting this happen? How can anybody ever really defend this? Oh, it's for the public good, the public health? Bullshit, Anybody that really supports this never, ever had any sort of love and respect for freedom, liberty, free choice, the right to, the pursuit of happiness. It's truly, truly disgusting what this world is coming to. And we need to fight it at all costs. I mean, it even says right here, the provisions of this section shall be utilized in the event of the governor declares a state of health emergency due to an epidemic of any communicable disease. So that's just not, right now. That's in the future. That's what your children, your children's children will be growing up in. They catch cold, they can be taken away. It's not crazy. That's what they're saying. We have to talk to people about this. We have to get the word out because this is truly horrifying. But as always, all of these articles that I referenced, they will be included in the show notes for you to please read. Share them with your friends. Share them with your family. Talk to people about what is going on. This is a battle of the mind and body right now. And the only way out of it is the spreading of the ancient idea of freedom and liberty and the right to, be independent from this giant centralized, authoritarian structure that is not being constructed around us. It's constructed. It's just that the bars, one by one, are being put into place. We need to fight it. But thank you very much for listening, everybody. I truly appreciate it. And actually, I probably should have started with this. Blues News Media, it is 1 year old today. This time last year in 2020, January 3rd, I came out with my very first episode, and I've loved it. It's been amazing. It's been quite the ride, and I hope you are enjoying it too. And I hope that we can learn, grow together, grow this platform, and just truly, hopefully, make a difference. So thank you so much for listening, guys. It means the world to me. But as always, you can find me on Facebook, Twitter, Minds. You can find me on, what else am I on? YouTube, BitChute, Library, wherever you find your podcast. Please like, share, subscribe wherever you are watching this. Share this video anything and everything you can do to support Blues News Media, we truly appreciate. And as always, thank you very much for listening. If you take one thing away from this episode, hopefully it is this: ignorance isn't bliss.